Hi, everyone. Stephanie again with the patient story. We're on to the second segment with Ivy, who just got done talking about, wow, an extensive, almost like year of going through tests and just trying to figure out what was going on. So Ivy, thank you again for joining us. We're going to now delve into the treatment that you underwent. And I'd like to start by asking, and I'll bring up a picture of you and Dr. Patel. How did she describe what the treatment plan would be?
Well, it's actually kind of interesting. I had mentioned that I found out I had an EGFR mutation while on the phone with her nurse before I came into the office. But when I went for my first appointment, Dr. Patel suggested I have a few more tests, one of which was a brain MRI, which I hadn't had at that point. And that's when I found out that I also had 8 small lesions in my brain, in addition to the bone involvement. Um, as a result of all of these kind of additions, Dr. Patel decided that it would be a good idea for me to speak to a neurosurgeon and to a radiation oncologist in the hospital before we made the final decision about starting me right away or not on an EGFR targeted therapy medication. So during one very, very long day in the hospital, I ended up going to talk to a neurosurgeon because it turns out that the pain that I had mentioned in my neck, which was one of my early symptoms, was the result of a pretty large sized tumor really high up on my cervical spine that didn't really show up in that initial MRI of my neck my primary care physician had ordered. Um, so when they got better visuals of that, they realized that where that's located could actually cause my cervical spine to become unstable and possibly even collapse, which, would not be a good thing for my survival. So the neurosurgeon talked to me about the pros and cons of having surgery before I started on treatment for my EGFR mutation. And that was one of the visits that I made that day. Then I also went and talked to a radiation oncologist that day who talked to me about the pros and cons of having radiation on some of those brain metastases prior or after starting my targeted therapy. I think the concern there was that if there were if there were 8 small lesions that could be seen, there might be more that were lurking that, might not even, have shown up on the MRI. So she kind of gave me the impression that at some point I might need to do whole brain radiation. So I have to tell you, so I did those 2 appointments and went back to Dr. Patel. And I mean, if I could say that I was, I started in, when I went in that day being somewhat terrified, I was beyond terrified by that time. My husband was with me, so, I had that support. But to tell you the truth, it was just so overwhelming. Now, I do have to say, I am very glad that I had all those conversations, and I'm very glad that all of those doctors weighed in with their opinions, and Dr. Patel talked to them, and they really figured out, what would be the best approach. By
Ooh,
speaking together and working together. I'm very, very glad that happened.
right.
Um, it turned out that Dr. Patel felt that by starting me on a targeted therapy for my EGFR mutation, which she did explain to me is could basically shrink the tumors or even have, them disappear all or in part,
Mhm.
that might take away the brain metastases and reduce the tumor in my cervical spine.
Right.
So the concern with my cervical spine is was whether that tumor was actually keeping my cervical spine from collapsing.
Um,
So that's where the neurosurgeon came in.
But so
Um,
I have to ask, just sort of interject here. Do you have, I mean, you'd already been through a whirlwind to this, up until this
mhm.
point. You have a million different appointments. For people who are trying to figure out who's the right person, who's the right doctor I should be listening to, what are the conversations I need to be having? I mean, what is your guidance to the people who are facing their own diagnoses now, both patients and caregivers? Any advice there?
Yeah, I mean, I have to say, I mean, you really need to, when you're first diagnosed, I mean, I felt fortunate that I had found a doctor who I really felt like I trusted. Okay. From the moment that I talked to her nurse and the moment I talked to her, I felt like, she knew what she was talking about. I had already verified that with, the other lung cancer survivor who I had mentioned earlier, and I felt like I trusted her. And she listened to my questions. She tried to get to know me as a person, and I decided at that point in my diagnosis, I needed to go with that trust, and I needed to allow her and her clinic to coordinate all my appointments and, tell me what I needed to do next. Now, that worked for me. I don't know if that would work for everyone, depending on who your initial doctor is, who you start with. But, there really was no time for me to go get a second opinion either because of this concern about the lesion on my neck.
Right.
So
Right.
that basically, I mean, I listened to her, and I left the hospital that day with a prescription for my targeted therapy and wearing a neck brace, which I had to wear for 3 months so
Mm,
that that was the concession to the neurosurgeon,
right.
that if I felt like the slightest bit of pain or increased pain in my neck, I would go back and see him. And I did have to have regular follow ups with him for a while, every couple of weeks, just to see how my cervical spine was doing.
Yeah, just to be diligent about that. So what I'm hearing are two big points there as well, Ivy, which
Mhm,
is one, to some people, just it depends on your situation, right? The time factor varies for people. Some
mhm,
people will have more time to be able to spend on research and second opinions. Other people, like you, did not have that
mhm,
maybe option as much. And then the second point being to have a doctor you trust and have confidence in, which you were able to find with your thoracic oncologist and your other specialists. So I'm really happy to hear that, especially due to your limited time figuring this out, that you were able to meet people you trusted and had good rapport with.
mhm,
And so, wow, this targeted therapy, we're in January of 2014.
mhm,
Just can you tell us about the pill or the medication, what it was, how often you had to take it? Did you
mhm.
experience side effects? And, just, yeah, share about that experience.
Yeah, it was a once a day oral medication. I took it every night before bed. I had to make sure that I couldn't eat for 2 hours before I took the medication. So, there was no late night snacking after dinner. I had to kind of make sure about that. But in terms of taking it, that was the only restriction. There were side effects that I experienced. Very common side effects for these type of TKIs are rash and diarrhea and dry skin and split fingernails or even the skin around your fingers. And just a certain extent, at least at the beginning, I experienced all of those. But again, I do have to say that my oncologist was very thorough about letting me know what, and her nurse, what to expect and what I could do from the very, very beginning to try to be proactive to get ahead of those side effects. I, goggled with a mouthwash for mouth sores. I had a prescription to put on the rash if it developed, and even an antibiotic to take to prevent it from getting worse up front. So I went into it kind of armed very, very well with ways to deal with and handle the symptoms the side effects, I mean, that I could develop.
Right.
And it wasn't that difficult of a process for me, but I was also very fortunate that I developed what seemed to me as, a good amount of side effects, but what I was told was a very mild case of most side effects.
Good, good.
And over time, I learned how to manage them.
Yeah. You got out
Very
ahead.
fortunate that, my first targeted therapy worked great. And my neck, the bone in my neck that they were very concerned about, um, grew back.
Right.
And yes, and I still remember after a couple of months of visiting my neurosurgeon, him saying, "Okay, well, we're not going to have to do surgery." He said that there was a profound improvement
Mm.
in my cervical spine. So, that was amazing.
Right.
All of my brain mets disappeared.
Wow.
They just disappeared. And my lungs, a little bit of nodules I had here and there disappeared, and my main tumor shrunk, a good amount, but didn't completely go away.
Okay.
And I felt pretty good, and those results continued for close to 3 years.
Yeah, I mean, and I was reading it was like basically three active lifestyle years with stable disease.
Yes.
And I'm gonna butcher this. Was it afatinib?
Afatinib, yes,
Afatinib.
was the drug that I took. Yes.
Okay.
Mhm.
And yeah, it sounds like, is it fair to say, characterize it as almost living with cancer as like a chronic disease? Like you're just managing,
Mhm.
you have medication you're taking, and then you manage the side effects. Is that how you were approaching this?
That's exactly how I was approaching it. I mean, I had to go back every 3 months during those, initial 3 years, and I still do, for scans. But in between scans, I pretty much just would live a normal life, I mean, I was able to do things with my kids. I was driving places. I was seeing friends. I mean, it was just a totally normal life.
And I'm going to bring up some photos too. I think you were, I don't know for sure. I think it does show, though, that you were able to just go on about with your life, with your family.
Mhm.
Did you travel during that time? And it seems,
We did. We traveled a lot, and I've always loved travel. So we went on several trips. Now, I can't remember which trips were prior to the afatinib stopping working so well or later, but we did some fantastic trips. We went to Puerto Rico, we went to Iceland, we went to the Caribbean, we've gone to Mexico. We've done some really, really amazing trips. That one's me with my husband and two boys in Iceland, at a beautiful waterfall. So we continued traveling. I got very involved in advocacy, traveled for, advocacy, lung cancer advocacy work as well.
mhm.
So it really did not put any sort of, hamper on my
Right.
activities.
And I read, thank you for your timeline. You talked about, as you'd mentioned earlier, just you did have to check in regularly. At first, it was,
Yes.
even say with the CT scans of your chest and neck, it was every 3 months,
Mhm.
along with regular MRIs of your brain. But then the following year moved from 3 months to 6 months of frequency. So, yeah. And then, of course, 2015 is when you became a lung cancer advocate. And we'll definitely talk about that in the next segment. But 3 years of active lifestyle. Then what happened? What changed for you?
Yeah, so in the about the middle of 2016, my oncologist actually moved from Northwestern to University of Chicago. So I went with her. And my first scan after that switch of my lungs kind of looked like I might have a little bit progression, but we weren't completely sure because again, scans were being done on different machines and being read by different people, and that sometimes just makes things difficult. So at that point, liquid biopsies had started to become a thing. And so I had a Garden 360 liquid biopsy to see if, anything would show up, but nothing did. I mean, it basically, it the result of the liquid biopsy came back and it was basically like I didn't even have cancer. Like literally nothing showed up. But again,
But before you move on, I'm not familiar with the liquid biopsy. What, in human terms, like what is that procedure like?
okay, so really it's basically just a blood test. I mean, get a couple of vials of blood, extra vials of blood taken beyond what you would have for your regular labs when you go in for a visit. And they send it away to a company that can look at that blood and see if they can pick up mutations from cancer cells or like pieces of DNA that are actually floating around in your blood. Now, if they can find something, it's fantastic because then you don't have to have a more invasive biopsy. But if they can't find something, it's not necessarily the case that it doesn't exist. There are, false false negatives with liquid biopsies where sometimes people are considered non-shedders where their cancer doesn't really shed those cancer cells or parts of cancer cells. And frequently, if you are just beginning to progress, or if you have, you know, not a type of cancer where you don't have tons of it in your lungs, you might be a non-shedder. So again, that came back, and there was a lot of inconclusive things at the beginning. So some time passed, and I went for my next scheduled CT scan, and it looked like there still was some more growth. So my oncologist scheduled me for a lung tissue biopsy, where again this was an outpatient patient procedure, just a day procedure, where I went in again, had twilight medication, and had a basically a biopsy needle put into my lung to take out some tissue and have that be tested to see if I had developed some new mutation that might be able to be targeted with another type of targeted therapy.
And it turns out you did test for something. Yeah, could you tell us about the T790M?
Yeah, so in the time during which I had been treated at the beginning, a new drug went through trials and developed to treat T790M, which is a very common secondary EGFR mutation that people get who were treated with some of the original targeted therapies for EGFR, like afatinib, and there were a few others. So when my results came back and it said I had a T790M mutation, I was able to go on this new targeted therapy medication, osimertinib. And I went on that, and I had a fantastic response to that one as well. Um, the tumor in my neck and my brain metastases had never come back since the beginning, by the way. But I had a remaining, my original primary tumor in my lung, and that ended up actually shrinking 50% from the size that it originally was. So while it hadn't shrunk that much with the afatinib, it had stayed stable, but now it really decreased in size until it was probably about, I think it was about a centimeter and a half, centimeter and 3/4.
Wow. Over what period of time are we talking for the shrinkage of
The
the?
shrinkage happened pretty fast within probably the first 3 months. And
Wow.
then
Wow.
it remained stable for an incredibly long period of time. I'm still on osimertinib, but it remained stable um, until I had surgery, basically.
Right, right, which was last year. And so I had read about you being a super responder to this second targeted therapy drug. Is that right? I mean, like you just really responded very well.
Yeah, so I've been on osimertinib now for a little over 4 years. What happened, and it's interesting because my changes in treatment always sort of um, go along with my oncologist changing hospitals. Okay, so at the very end of 2019, my oncologist went back to Northwestern from University of Chicago. These are all promotions for her. So, they're wonderful. And, it's in the Chicago area, so it's not that difficult for me. But it always does kind of make things a little confusing in terms of my scans. So when that happened, again, there was some question about whether there was some progression in my lungs or not. And still, no one even knows whether there was or not. But, a lot of time had passed at that point. And at that point, I was 6 years out from my initial diagnoses. And while I was first diagnosed, no one would ever, suggest a stage 4 lung cancer patient have surgery. It was kind of becoming, well, I wouldn't say common. It was kind of becoming an option for some stage 4 patients to be able to have, more of an out of the box treatment, whether that meant surgery or whether that meant radiation of their primary tumor in order to hopefully improve their overall survival. So initially, when it was kind of questionable whether it was growing again, my oncologist said to me, "Well, how would you feel about just getting your primary tumor radiated, since that's the only place where anything, in your entire time since diagnosis has even grown?" And I thought that that was, a good idea. It went to tumor board at my hospital, and they came back and said that I was a candidate for surgery. So I decided, well, if I was a candidate for surgery, I would rather even do that than radiation, because I could just get an entire lobe of my lung out where all of the cancer was, and hopefully not have side effects that might come from, radiating that area of the lung. And that's what I ended up having done. Just about a year ago from today, I had surgery, had my upper right lobe removed. And as a result of that, became NED, no evidence of disease. And it's a year later, and I still have no evidence of disease.
I mean, such an inspirational and incredible experience and story to hear, Ivy. I would love to go into the surgery, and I'm going to pop up some photos you sent over from pre-surgery and then after. Do you remember what you had to do before the lobectomy and how you were feeling as you were going into surgery?
Well, right before the lobectomy, this is one thing that I wanted to mention. I had to have another procedure done too, an EBUS, basically a special bronchoscopy to check that, even though I had a PET scan also prior to make sure nothing lit up anywhere other than the primary tumor, I had this EBUS bronchoscopy as well, so that they can make sure that there was no cancer in any of the lymph nodes outside of, my upper right lobe. So that was, the first thing, because they wanted to make sure that if they were going to take out a portion of my lung, they wouldn't then find,
Right.
cancer somewhere else, and then that would negate the benefit. Um, I, went to the hospital that day with my husband, changed, got my IV. There I am with my surgeon and her PA. And, I mean, this was general anesthesia. Ended up actually being a 4-hour surgery. Um, and they removed my upper right lobe. I have to tell you, I mean, by the time I came out of surgery, they had me up and walking probably within an hour or two. And I spent, I think, a total of 2 nights in the hospital. Getting up and walking a lot was key to kind of both pain management and getting my lung capacity up again. But I mean, I won't say it was pain free, but I'm so glad that I had the surgery. I really am.
Yeah, yeah. Could you, I mean, so this is the picture before surgery. I'm going to pop up the one after. You said recovery wasn't too bad. Is there any guidance for anyone in terms of, people are nervous about any surgery. Do you have any sort of words of advice or, yeah, guidance for people
Yeah,
who,
I mean, I have probably two things to say really about that is that I tend to be a person who usually doesn't take pain medicine. Um, so I was given a lot of advice before the surgery, and people said, if you feel pain, you need to take that pain medicine before that pain becomes overwhelming. And I have to say, I did do that. I made sure to take advantage of the pain medicine that they were giving me and tried not to be like a hero and tough it out. And I think that made my recovery a little smoother. I also made a big effort to get up and walk as they told me to do, both in the hospital and once I got home. And, I walk, even to this day, I started this whole thing where I walk 30 minutes a day on the treadmill. Of course, I couldn't do that right out of the hospital.
right?
At the beginning, I was walking 5 minutes on the treadmill, and that was enough, but I've kind of kept it going. And I have to say, I've never been a marathon runner, but, I don't really notice any long-term impact on my lung capacity. So really my advice would be take your pain meds and walk as much as you can.
And take it one step at a time.
Yes.
And don't try to be a hero. I mean, there's a lot of good tidbits there. And then just what's the follow up been? I mean, first of all, to hear
Mhm.
no evidence of disease, if you could walk us through that, and then talk about the follow up and how often you have to check up with your doctor still.
Well, no evidence of disease is not something I ever thought I would hear when I was first diagnosed. Stage 4 lung cancer, you don't think you're going to hear that. So, of course, it is amazing, amazing to hear. Does it mean that the cancer will never come back? We don't know, you know. But it is definitely, or at least hopefully, going to last, long enough to push things a little bit down the road, where if it does come back, hopefully there'll be newer and better treatment. But, fingers crossed that it doesn't come back, of course, is always the hope.
Of course.
I I'm sorry, what was the rest of the
Yeah, I
question?
mean, just the follow up that you have to do, yeah, with your oncologist.
Yeah, so my follow-up, to tell you the truth, hasn't really changed. I'm still taking the osimertinib because, no one really knows what would happen if I stopped taking it in terms of brain mets and the lesion on my neck. And since I really don't have any side effects from this, my second targeted therapy, there's no real advantage to getting off it at this point. So since I'm still on what's termed active treatment, I still see my oncologist every 3 months. Every 3 months, I have a CT scan of my neck and my chest. So, can check my lungs and check that lesion. And every 6 months, I have a brain MRI. So that's the ongoing treatment at this point.
Ivy, my last question to you before we head to the last section where we talk about quality of life topics and your advocacy work is, living with cancer as sort of this chronic illness, like you had talked about before. And you're on this new targeted therapy and you're not going to get off it because you had just said no one knows what happens if you stop, right?
Mhm.
It's just so new. How
Right.
does it feel to, you're kind of a pioneer almost in this way, right? And you've had such a great response. And I think people are looking at your story and getting a lot of hope. But what is it like being in your shoes, living with it and having that every 3 months and taking the targeted therapy still every day?
Yeah, I mean, I have to tell you that whole living with lung cancer, I mean, there is still a lot of uncertainty that comes with it, because you still are living between scans. I do have to say, earlier on in my whole diagnosis journey, I probably experienced more anxiety between scans and getting ready for my next scan than I do now. It's kind of twofold. It's kind of after you've been, living with something for over 7 years, it's hard to sustain that amount of anxiety. But also, and it also help it, knowing that, I'm currently no evidence of disease helps a little bit. But in addition, just the fact that I have gotten very, involved in advocacy, and I'm knowledgeable about the research and trials and new treatments that are coming along, that also helps me feel a little bit better about things as things have gone along. I just feel like there are a lot of good options out there and more are being developed.
Absolutely.
So that has helped me a bit too. And I just try to kind of focus more on living, each day and what I can accomplish that day, as opposed to worrying tons about the future. And I'm not saying that's an easy thing to do. I mean, I'm, over 7 years out. I've had a while to kind of, work on that, and a good amount of therapy to kind of work on that and figure it out, honestly. But that is kind of changing my mindset in that way has really, really helped me in managing the fact that, you are living with these ups and downs and, constant uncertainty and more, anxiety. And then you have your time between scans where things are quiet.
Yes. Yes.
So,
That's a great segue into our last video, which, I hope people will stick around and watch because it's about, you talked about mental health, you talked about, self advocacy, and then becoming a patient advocate in general. So, yes, hang tight, and we're going to bring Ivy back for this one last segment. Thank you.